I'm Carmen Woodland, your host of the Myo Minute. I am very grateful that you're watching this episode, and thank you for tuning in to my channel. Today I'm going to be talking about what age of people should be doing myofunctional therapy. This is a question I get asked a lot, and I answer a lot of emails from parents with young kids, and they know that there's a concern, so they know they need to get started, but they just don't know what is the ideal age. So the first thing I want to talk about, what really kind of sets apart dental hygienist background myofunctional therapists from like a speech language pathologist background, is that it is important that our clients that we work with as dental hygienists, that they have volitional control of the muscles. So what volitional control means is that they that they have control, that they can choose to work those muscles. So in the case of like an infant or a toddler or somebody who's had a terrible accident like a stroke or maybe has a traumatic injury, those people are not going to be able to have that control that's required for a dental hygienist to work with them. So if that's the case with somebody who's reaching out to you, those people are going to be best served by a speech language pathologist, an occupational therapist, or some other specially trained medical profession that can work with all of the stages of swallowing, because as a dental hygienist, we only work with one stage of swallowing, and there are 4. So in my practice, I really have 2 options. I start seeing clients about age 4 or 5, all the way up to my oldest client right now is 79. So I divide those clients based on age and need, really. So first, let's talk about my mini Myo program. This is for the age range of about 4 to 5 to 7 or 8, give or take a little bit. I have worked with a younger kiddo who was 3, but I require anybody who enters my mini Myo program to be able to comprehend, comply, and cooperate with therapy. So this little guy who was 3, he was having a frenectomy done. He had a real severe speech impediment because of the tongue tie, and so we had no choice but really to get started so that we could get that frenectomy completed. It wasn't ideal, but it was what we had to work with at the time. So in that case, mom knows that that kiddo probably will be in therapy with me for a couple years just to make sure that we have the success that we wanted. Now, in the mini Myo program, parents are so important. I am always stressing to moms and dads that they have to be as dedicated to the therapy as the kiddo, because they're the ones who really are going to make the therapy happen. And then for my older clients, I really base the therapy program that they go into based on what they want to gain from therapy, what their needs are, what their personality is. And so take somebody like an 18-year-old male. He is going to be best served by working with me comprehensively, which is for a year, rather than just learning the tools and being turned loose, because I want to work with clients through habituation. And if a client won't do it on their own after working with me and continue working on those habits, then it's real important that I continue working with them and hold their hand, hold them accountable, and make sure that this is becoming something that they don't have to think about anymore because it's a new habit. And then what I mean by personality, if I do an assessment with somebody and they say that they know they need an accountability partner, then it doesn't make any sense to do anything else. So that is how I decide what program those clients go into. But regardless, you guys, there is nobody that is too old for myofunctional therapy. There is somebody who's too young, because remember, they have to have volitional control over those muscles, but otherwise, it's fair game. It just depends on what program they're going to be put into. All right, there you go. I just talked about what age people can do myofunctional therapy, and I also broke down my programs for you. Thank you so much for tuning into this episode of the Myo Minute, and I will see you next time. Bye for now.